first thing I wanted to do is try to get a sense of exactly what type of clinical procedure we're doing here, or what's the issue that occurs with these patients where AceConnex comes in and is an excellent solution for these patients.
I can get started. So hip arthroscopy is a procedure that addresses hip injuries of the hip that are soft tissue injuries, labral injuries, femoroacetabular impingement, and we've seen a proliferation of this procedure the past 20 years or so. And with that, we're learning a lot more and more about kind of how the hip functions. And what we're seeing in 2025 is that sometimes the labrum, the soft tissue gasket ring that sort of fits around the hip joint, is not in a situation that can be repaired or salvaged. And so luckily we've learned a procedure called a labral reconstruction, in which we replace part or all of the labrum with a cadaver graft. And what that does, it provides a lot of the labral functions and anatomy in a situation where the labrum is deficient or not repairable.
Yeah. And just to piggyback off that, there's been a real evolution in terms of labral treatment and management. Early days of hip arthroscopy, starting off with just labral debridement or labral excision. As our techniques and our implants became better, we moved on to doing labral repair. And what we invariably came up with was there's some instances when the labrum was very badly injured and couldn't be repaired. And so then you're left with the situation of necessitating a labral reconstruction or graft in that case. And techniques have even developed in terms of doing things like labral augmentation to treat a hypoplastic or diminutive labrum as well. So it's really been an evolution technique over the past several years.